Hey everybody, what's up? Physical therapist, Dr. Ryan Welton. So, today I am talking about lumbar stenosis and what to do about it. Okay, lumbar stenosis is tricky, and the reason why is because it's a structural issue. Okay, so if we talk about the central canal stenosis, right, and the central canal where the spinal cord sits, a lot of people, especially advanced in age, have arthritis, right? So when you have arthritis, it's tricky because you can't like fix the arthritis, right? So there's varying degrees, like anything, of stenosis. You got um, mild. I'm not too worried about it. When they say mild on the radiology report, if they say moderate, I'm like, okay. But when they use the word severe on a radiology report, I'm like, those can be tough. That means it's just straight up bone on bone. Okay. Um, so the behavior the behavior of lumbar stenosis is that the person has trouble standing, right, for long periods of time. Um, and they have to sit because when you stand, you put yourself into lumbar extension, right? Further adding stenosis or narrowing of the central canal. So, um, but what also is, can mimic lumbar stenosis is actually SI. SI, if you work with these patients, like they have trouble standing for long periods of time sometimes, and then they have to sit. A lot of my SI patients who are in their like 30s can't get through the grocery store without strategically having a place to sit to keep going. So you have to rule out SI. Now, I publish statistically historic papers in the field of orthopedics and in medicine in general, called in readership root cause of SI joint dysfunction, root cause of sacral torsion shear. In there, I talk about lumbar stenosis as well. But so read those on my school group below. Click on my school group, SKOOL. Click on my school group below. Now, so I always rule out SI just to make sure that although they might have stenosis on an X-ray, MRI, CT, whatever, that this isn't masquerading as SI. Okay. So like the other day, I did have somebody in here with severe spinal stenosis. And I'm like, but I wanted to rule out SI. So I opened up his SI and he couldn't walk like 20 feet before he like needed to sit down type thing. Right. And I opened up his SI. I even hugged after I pulled on his upslip. You got to get the upslip first. Read my paper. Join my school group below. It's in there. I hugged his ASIS immediately open to see when he needed to sit down, whether I could open it up and relieve it, and I couldn't. So that told me that this was a very severe case of lumbar stenosis. Now, what to do about it. So what I tell these patients, these lumbar stenosis patients, is first of all, I'm a very straight shooter with people. I don't BS people. I don't, you know, that gets you nowhere in life. I tell like my SI patients, like, yeah, no, I'm not generally worried about stabilizing SI joints, which I believe in my patients for the last 20 years of my practice that's the most common cause of low back pain and quote unquote radiculopathy. But my lumbar stenosis patients, I tell them, look, a lot of times I can make this better, but it's arthritis and I can't make it go away. I can't fix the arthritis. You know what I'm saying? So like, I mean, I say the majority of people I can help with this make it better, but I can't make this go away. Okay. And, and it's important to be truthful up front of what your limitations are as a therapist, what you can and can't do, and you learn that over time. And a lot of people that are using my protocols, you go to my school group below, click below, go to my school group, or go to weltonmethods.com and click the free VIP link, and it's free. You can join. And I discuss more in depth on how to help all these different conditions that I talk about. Okay. Now what to do about it? Okay. So there's one thing that is not good, but makes me happy in a lumbar stenosis patient when I see it. And that is a hyperlordosis, or a lot of times they have a big belly. Okay. Now, why? Because in a hyperlordosis patient, they got a big sway back, right? Great, I can work with that, right? How? Is you tilt the pelvis posteriorly. So you create a posterior pelvic tilt. And when you create a posterior pelvic tilt, you flatten the spine. Okay, so they went from that, a hyperlordosis, to that. But I've found it takes like 8 weeks to even start noticing a difference. And you have to tell them that up front, otherwise they quit. Nobody does exercises for 2 months and not notice a difference. So I tell them that up front, that this is going to take 8 weeks to even start noticing a difference in this rehab. Now, what you can do is you can stretch. I talk about this in my rehab results course. Click on my school group below. All my orthopedic protocols. Is what you can do is the hip flexor stretch. Why? Because the psoas attaches to what, L2, 3, 4, something like that, right? So when it's tight, it pulls the person into lumbar extension, right? So you need to stretch that, but you can't put them into lumbar extension. If you put them into lumbar extension, then you're making it worse. So I tell them just to tuck your butt, do a posterior pelvic tilt while we're doing this, and to amplify the stretch here, okay? And one of the other things you do, so you're working the front to loosen that up to get rid of the hyperlordosis, right? And the other thing you can do, aside from like what do they call it, a Williams flexion program, knees to chest type thing, is important too, is hamstring curls. So I just have them stand at a counter with a weight, they have to use a weight, and do hamstring curls, okay? Why? Because the hamstring comes up and attaches to the ischial tube, right? And when it attaches to the ischial tuberosity, it tilts the pelvis posteriorly, okay, when you create strength in it, okay? And then that further flattens the spine, okay? So a lot of times with stenosis, people are on the right track, and they use a flexion program, but they don't stretch the hip flexors and don't strengthen the hamstrings, okay? And that is very, very important in these patients I've found, is that you have to, and it takes like 8 weeks to start noticing a difference, and you have to tell these people up front that no one's doing exercises for that long without noticing a difference, okay? They will quit on you and say it didn't work, okay? I've been in business for 17 years, treating for over 20 years, and trust me, that's usually the typical result if you don't manage expectations. One of the most important things is to manage expectations, okay? Now, so lumbar stenosis or hyperlordosis of the lumbar spine can be tricky, but you have to open it up, okay? And then there's another, I always put people on my SI, I recommend from thoracic into the foot, put them on my SI protocol anyways, okay? Why? Well, the reason why it can help with lumbar stenosis is you're doing knee to opposite shoulder, right? You're doing the piriformis stretch, and that further opens up it's like knees to chest as well, but knees to opposite shoulder, and that further opens up the canal in there. Now, it's interesting. I mentioned that I believe in my clinical observation of having basically chronic low back, I see everything, but chronic low back pain clinic, that SI joint sacral torsion shear is the most common cause of back pain. And it was kind of a rule out diagnosis before, but I published that statistically historic paper that you can read in the school group below, or go to weltonmethods.com, my website, and click on the drop down. It's at the bottom, join my free VIP group. And I talk about that in that paper, how to evaluate and treat, a diagnostic method I came up with, how to evaluate and treat SI joint. And when I figured out that with my patients, I started opening up patient after patient after patient. I could tell that although you had this crazy herniated disc or bone spurs or whatever, stenosis on your MRI, that this wasn't actually the cause of pain, because when I open up your SI joints and never touch your spine, you're pain relieved, down your leg and, in your low back. So I could tell right then and there what was what. Now, I've been saying that for the longest time, and my students and the people that are doing these protocols all around the world are messaging me in my clinical group, my school group. Please join it, it's free. They're starting to say it too. Like, yeah, no, I'm with you, man. This is the most common cause I'm seeing in my clinic too, But like I said, SI was a rule out diagnosis before. So once you actually figure out how to, diagnose it and relieve their pain immediately, what goes away when you realign their SI is, a lot of times you have to hold it open, but realign their SI is SI, So it takes the guessing out of what's SI and what's not. Anyways, that's that. But also, if you are interested in running a extraordinarily successful cash-based clinic, if you are tired of the insurance scam, which is a scam, that's what it is. It's a scam. Like I initially tried to start 17 years ago with it. I wasn't sleeping. I was fighting with insurance companies, and I started to realize I was involved in a colossal scam, and I couldn't treat patients the way that I wanted. They wouldn't let me, or if you're in a PT mill and you're starting to have mental health issues, which I don't recommend that, then there's a way to jump ship. Now, the thing is that I teach, it's a unique course. It's a hybrid clinical and business course. So I teach you the clinical techniques, diagnostic procedures, and protocols that I use to get the results that I get. That's what I use in here, and people are copying and pasting that and not worrying about the clinical part of it. They're saying, like, I'm not worried about that. I just use your protocols, okay? And then I teach you the business part. I give you everything from marketing to build your landing page to the funnel to everything. And I give you what to say, what to do, that kind of thing. So it's an all-inclusive, and it's a very profitable business model. We charge $400 for 30 minutes. I teach my students how to do that and be confident in themselves to do that. People are dying for someone that actually has invested in their education to be able to help chronic pain patients. They're dying for that. Trust me, they come here all the time. I had like 2 PTs recently come in here as patients. I see PTs all the time. 2 PTs that one of them just broke down sobbing, uncontrollably. She had SI, they try everything, and it was mechanical. So anyways, it's tragic, but also we can help. And I will teach you how to open and run, target, get these people in your door, and they will pay you for your clinical skills like any other industry, like lawyers or good accountants or something like that. They charge big money if you're good, but they also, people are willing to pay that because they know that there's a very good chance they're going to win the case or save money on taxes or whatever it is, right? Anyways, that's that. I recommend you join my school group. It's free below. I have my papers in there. I also have more advanced clinical teachings. And beyond that, everybody have a wonderful day. I love you all. Peace.